Support for Consider This is provided by the University of Nebraska at Omaha College of Communication, Fine Arts, and Media.
From the campus of the University of Nebraska at Omaha. Consider This, a program of issues and information behind today's news.
I'm a composer, and I have social anxiety disorder.
I am a football player, and I have a bipolar disorder.
I am a scholar, and I have schizophrenia.
I am a doctor, and I have OCD.
I am an engineer, and I have panic disorder.
I'm a leader, and I have depression.
Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. Our topic, Mental Health Month. Here to talk more about it are Kevin Kaminsky, Director of Behavioral Health Services at Catholic Charities of Omaha, and Janae Shillito, Community Relations Director for the Kim Foundation. Thank you both so much for being here and welcome.
Thanks for having us.
Kevin, I want to start with you. How do you define mental illness?
At the most basic level, mental illness is the instability in one's life, be it emotional, psychological, physical, and when it boils down to it, socially. So when an individual wouldn't be able to go to work, wouldn't be able to function on a day-to-day basis. So a majority of individuals throughout society will be able to function with mild depression or mild anxiety, but mental illness, from its milder forms to the more severe forms, will have more significant disability as well as lack of functioning as an individual goes through life.
And how many people are we talking when we're talking mental illness?
Numbers can vary, but they're fairly consistent. In about 2014, SAMHSA put out some numbers where 1 in 5 adults was suffering from mental illness. With that said, about 4 to 9% of that we're suffering from a severe mental disorder. And then it gets a little more severe from there when we talk about children and adolescents. We're talking about 20% of school-age children between 13 and 18 years old could be diagnosed with a mental health disorder, from anxiety adjustment all the way up to more severe disorders such as major depression, bipolar, and the early onsets of those disorders. And it should be noted that from the first onset of a disorder, it takes anywhere from 8 to 10 years for someone to seek out help. So we're talking about a decade, almost a decade of a struggle. So if someone were to start having significant signs of anxiety at the age of 14 or 15, we're looking at all the way up until 25 years old until they really will share those early onset signs and the more significant dysfunctions that they're having or delays that they're having in their social life or their work life, or just their overall personal health. So we're talking a very long period of time when you think about it.
Which really impacts pretty dramatically what you do, Kevin. I mean, you are having to go back in time quite a bit with your clients, I would imagine. Talk a little bit about that gap in terms of how that affects that client-professional relationship from the get-go.
Right. So exactly, I think stereotypically we see that where we'll talk about, my profession in therapy, therapists, social workers, and whatnot in the mental health field will look at childhood and look at all of those things, all those areas in one's life, because we want to know when that initial onset was, so we know what those struggles were and maybe where some other areas of difficulty came from. And so we will talk about those things with, let's say, somebody who's 25 or 30 or up to 50 years old. We'll talk about those early situations, mood swings, events within their life, especially their relationships and how they functioned within a workplace or within school, if it impacted their learning. Some of the great things that we're doing right now, though, is that but especially here in Omaha, and for my program especially, we're in schools. We're in 7 archdiocesan grade schools and high schools now, and we're talking with kids who are having emotional problems or having difficulty with relationships or just adjustment in general because of situations of, in some cases, neglect or divorce, or even the transition from 8th grade on to high school. So those are some of the more significant to basic things that we're talking about, because we know that it is essential to catch it early, because the early detection and the early treatment that we're providing allows us to mitigate some of those long-term effects.
Let me ask you, when people wait so long,
Mm-hmm.
are they able to go back in time and pinpoint pretty quickly where this all started, or is it something you really kind of need to help them dig a little bit to find, Kevin?
Sure. It's all in the way that we want to work with a client to find out. We want to definitely mitigate some of the issues that are going on in their day-to-day life now, so that they can continue to function at this time. What we do find, and some of the most positive things that we find when working with clients, is the resiliency of our clients, from youth to young adulthood through their adulthood, that really they've been resilient through all of that time, and they reach a point where they've gotten their fill, and it makes it more difficult for them to function and to maybe even problem solve basic living skills or basic problems within relationships. So we try to mitigate all of that now so that we can take care of some of the deeper issues in the back and then help them kind of move forward from that. So it's always looking at that resiliency and moving forward.
Yeah, moving forward to be able to deal with whatever it is they're dealing with. The opening video, I
Correct.
mean, really does point out no one is immune. This strikes everyone. Pretty
Correct.
much what you see.
Yes, absolutely. So I work with individuals who I've worked with and currently work with individuals who may be in or below the poverty level, all the way up to individuals who are in more affluent positions throughout the community, and they've functioned, and all of them are functioning at some level, and so we just try to make that functioning a little better.
Okay, thank you. Janae, welcome.
Hi.
Hey, so we've already touched upon it a little bit, but folks really reluctant to come forward when they believe that they may have a mental illness. What is it that you see in terms of the biggest reason with the people you meet?
Yeah, the people that we talk to, in our society, we see physical health viewed extremely higher than mental health, and we're putting our physical health on a pedestal, unfortunately, and we tend to close off our mental health because there are so many stigmas labeled with mental health. There's the social stigma. It's not widely accepted to have depression outwardly or to have anxiety outwardly. People look at you different. The real definition of stigma is, a disgrace or a dishonor against a particular person, a situation, or a certain illness, not just with mental illness, some physical illnesses as well. And we're also seeing almost a self-stigmatization when they have that perceived notion, when if community looks at me like this and they think I should be acting like this, maybe they're right. When they're hearing it so many times, you're crazy, you're psycho, we put all these labels on people and they almost start to believe it. But it's something that we really are, especially at the Kim Foundation and Catholic Charities alike, are looking to really break down that barrier and view physical and mental health the same.
Yeah, it makes it very understandable for people like us, but then you look at somebody like a superstar, right? Like Mariah Carey. We do have a video that we want to show to our viewers. Again, no one immune. She just recently stepped up and said, hey, this is going on with me. Let's take a look.
Mariah Carey is revealing her battle with bipolar disorder. The music icon sat down with People's editor-in-chief Jess Cagle and opened up about her years of suffering in silence with her mental health and why she's finally ready to share her story. Carey reveals that she was first diagnosed with bipolar II disorder. It's a disease that can cause extended periods of depression as well as manic episodes. It was in 2001 when she was hospitalized for an emotional and physical breakdown following her divorce. Now, in the years that followed, Carey says that she lived in denial of the disease. She says, quote, "I didn't want to carry around the stigma of a lifelong disease that would define me and potentially in my career. I was so terrified of losing everything, I convinced myself the only way to deal with this was to not deal with this."
What do you think about, Janae, when you watch that video? Probably pretty common message, right?
Right. It's so empowering to have celebrities and those that have power in our community to really come out about what they are facing or struggling with, because it lets people know who are just part of the community, maybe don't have a power position, that, okay, they're just like me. They suffer from the same things. They suffer from anxiety, depression, bipolar, and they can get help.
Mm-hmm.
That's the main point, is that Mariah Carey went to go get help, and that's what we're trying to get to people, is that just because you have something doesn't mean you have to have a label or you have to be cast in the corner. There are places that you can go, and there are people that want to help you.
Yeah. So Kevin, you're a go-to in this community, correct? Mm-hmm. So viewers who are watching up to this point, what would you share with them if they're thinking, I can kind of identify with what they're saying, and I think maybe I ought to reach out and call someone?
For me, sometimes the first step is to talk to your primary care physician, whoever that is. You have that relationship, and it doesn't have to be a specific or a specialty practitioner right out of the gate, because you want to go to someone that you trust, that knows the whole picture. And now the community in general, the health community, the physical health community, as well as the mental health community, has done a great job of kind of upping their game, where they'll screen, they'll make sure that they are looking at these pieces, and if you bring it to their attention, they're not going to just kind of blow it off anymore. And so that's the first step. Mm-hmm. Go to someone that you trust, be it your primary care physician or whatnot. Accept that referral. Ultimately, what the research does say is therapy along with medication work best together. Mm-hmm. That the efficacy of that, so that if you're looking for maybe, I'm going to try a medication and hopefully it'll help with the depression or the anxiety or whatever issues that are going on, that's a great first step. I never say that that's a bad one. My business is to talk, to learn how to interact, because in most situations with a mental illness, to achieve true mental health, what we want to do is we want to bond with other people. And as human beings, we are social animals, and we want to have that connection. And that's where that therapy will help, is to reconnect that someone doesn't feel alone, that the problems that they're going through are definitely manageable, and that there isn't judgment when they sit in that seat across from someone else, that they can talk that through and go from there. And definitely take whatever resources that are out there. There are great support groups out there in the community. NAMI is a great resource. And then ultimately, if there's other issues that are going on, alcoholism or drug abuse, definitely reach out for those services.
Let me ask you something. So the individual finds someone they trust. They go, they have that conversation, they walk out of that office thinking, okay, I can do this. What percentage of people get to their car and never make that next call? And why don't they do it?
Well, it depends, again, who they reach out to first. If they reach out to their primary care physician and they are given a referral and that referral takes longer. I mean, really, that is the number one barrier. And Janae would agree that, I think, that referral piece is the biggest piece, is that when there's a delay of more than 2 weeks, we're going to lose that person. Right. Because then it becomes, I'm marginalized. And so I'm not that important to get in, even though I'm asking for help. And so I'll just go on the way that I was. And so really trying to make the effort to get those first contacts in within first 2 weeks within that first call, really first week. And that's the difficulty, especially in our community, with access to services and whatnot. But at Catholic Charities, we had that program where someone would come and they would be able to get in kind of on a rolling basis. We had available spots, and most of the community still is doing that, where you call, you're going to get in within 72 hours to a week, hopefully, for therapy. Medication management with a psychiatrist is going to be a little longer. But again, that is the key piece, is hooking them right away so that they know that what they're saying is important no matter what they are saying.
So Janae, let me ask you, they go, they visit with that trusted professional, and it is just 72 hours, right? But that can seem like an eternity for somebody who has found the courage to step up and do that. Do you have any advice for people for that time frame in between going to the trusted professional and the next step?
Yeah, I definitely think that somebody who is struggling and has reached out needs to find other support systems and confide in some others, close relatives, family or friends as well, because they can really help them on their journey and get them to that next appointment. Even if they know that it's coming up and they know that it's set in stone, that support system can really help them get there. I mean, as Kevin said, we know that the onset of symptoms to getting treatment, the delay is so long to deal with those thoughts. I mean, if you're having to deal with depression or suicidal thoughts, worse than that, you're waiting all that time, and all of those thoughts and emotions are just getting worse over those years. So really 72 hours is really important. I mean, getting them to that service is so important. So I think confiding into other family and friends and any other support systems, churches, clubs you belong to, if you play an instrument with somebody, some other connection, let somebody know what you're going through, because they will definitely help you get to the right support system too.
Fantastic. Kevin, I want to talk about treatments here. So they've gone to the trusted professional, they've waited that 72 hours, and then they're able to find a person with whom they can walk. What types of things can they expect in terms of that person on the other side of the desk suggesting that they do maybe to change their life?
Well, it all varies by the individual practitioner. Even sometimes it'll vary when you look at private practices. Sometimes private practices will hold the same theory of practice, and so again, it's going to vary, but what you're going to find and should be consistent across the whole field is compassion, is non-judgmentalness, a sounding board of sorts, and a reality that the individual, as we said in the opening remarks, is that there is such a long period of time between the onset of symptoms, not just to wait for help, but the recognition that I need help. So 8 to 10 years. So in the grand scheme of things, when I say I want help, that's 72 hours. The professional is patient with them. That I know that when they come to me, that the individual wants success right away.
Right.
And I explain right away that how long has this been going on in reality? It's going to take us some time for you to start feeling better, to do some different things so that you see results. And so, again, what we do as professionals, we give that time, we make it available, and we talk to them with regards to what they truly want to change about their life. Sometimes it's very broad, and we have to narrow it down to manageable pieces. And then also within that first month, trying to build more supports throughout the community, within their personal community as well as the larger community in general. And then long term, being more functional within the community. So again, whatever theory that a practitioner may use, they're going to it all comes to almost the same head. It's just how we get there, that journey. And sometimes I also explain, and most practitioners will explain, that this therapy may not be the best. This may not be the perfect fit. Please tell me, because when you tell me, that's the first part of your recovery. You're taking accountability that I need something, and this isn't what really works. Again, I'm not going to take that personally. I want them to be able to choose the practitioner that will work best with them and for them. And so not thinking that just because I got in here today, it's the only place. And that practitioner wants you to tell them, hey, you're on the road to recovery, and so let's work on that. And the number one thing you should be able to tell me is, I need something different. And so, just giving the person that strength to talk.
Yeah, Janae, every journey is different. We can't stress that enough. What works for one person isn't necessarily
Right.
going to work for another person. As a resource in this community, yeah, what would you say to people when they call you and say, well, this person went down this path and this is how it worked out?
Yeah.
Can't stress that enough, especially when someone does finally realize that light bulb goes on and they say, okay, I'm going to do this. Now it's almost, tell me what I want to hear, and that's not necessarily, right?
Yeah, oh, definitely. The phone calls that we get, we just try to emphasize patience, because unfortunately it's a trial and error effort.
Yeah.
We don't know what treatment is going to work for every single case of depression, every single case of anxiety, because we all come from different backgrounds. We all have different experiences that got us to this point. Our, socioeconomic status is different, our gender, everything about us got us to this point and makes us who we are today. And unfortunately, that means that treatment is not going to be the same for one person who has depression and another person who has depression or any other mental health condition. The thing about mental health is it is the one branch of medicine that, as Kevin was talking about, this talk therapy, it's the one branch of medicine where we're trying to serve the symptoms that are only being talked about. It's something that we can't really put our finger on. So that only furthers the stigma and really makes people turn away from help. So, yeah, and Kevin, I'm sure you see that a lot.
Well, and when we say success, and you mentioned that earlier, we know we're successful when in this realm. Kevin, how would you finish that?
For me and the majority of the clients that I work with is when they have a voice, when they can stand up for themselves and say, no, you're wrong. That's not what I meant. Good. The other piece is that they can take those steps on their own. They stand up for themselves. Again, with respect, they have respect for themselves. There's changes in their physical health. There's changes in their social health. There's changes in every aspect of how they view themselves and how they put themselves out into the community. And that some people, it will take 3-6 months. Other people, it can take years. Because as they go through this journey, as you said, we only can talk about and try to solve or try to figure out why we're doing what we're doing or why we're feeling the way we're feeling, because we're talking about this symptom.
Right.
Well, this symptom is also masking something else, and then it can uncover another thing in another area. And as mental health takes hold, the mental illness pieces start to come out more and more, and that we came in for depression, but we figured out that I have a more significant trauma that I had blocked out for 30 years.
Yeah.
Or that every time I got depressed, I would drink and then I would be picked up by the police and there was another trauma. And so as they say in my training, it was always talked about as the onion. As we peel back the onion, we find more and more layers. And I guess that's exactly what it is that as we peel things back, we're going to find more and more until there's no more layers. And we know we've had that success. And again, it just is variable depending on the person.
Okay, thank you. Let's back it up a little bit now and go through, for viewers especially who think that they may know somebody, or maybe even themselves. Let's go through the signs, Kevin. We're going to put a graphic up for our viewers, and as we do that, tell us what's important to know about the early piece of things.
Early detection, as I said, with some of those numbers that I threw out, is vitally important. By between 14 and 24 years old, over 50% of adolescents are going to deal with some sort of mental health issue. Not only that, 90% of anybody who takes their own life or tries to take their own life will actually have a diagnosable mental health issue at some point in that time frame before they kill themselves or try to kill themselves. So ultimately, when we talk about early warning signs, I've always talked about how one person's struggle with, let's say, schizophrenia is like someone else's struggle with an adjustment disorder. They are, by all stretches of the imagination, they are polar opposites.
Yeah.
But in reality, if the person who has schizophrenia and is suffering from schizophrenia has the supports and they're getting the treatment that is actually appropriate for them, they'll go through life without any or very minimal issues, whereas an individual who is going through an adjustment period, or they're a youth and their family has split up and there's divorce, and they become depressed and it doesn't get talked about, that depression from such a common occurrence in today's society can morph into something greater. And so for me, when somebody is isolating themselves, when somebody is decreasing their social activity, let's say even if they were a moderate student, C's, B's, kind of all over the board, and everything is kind of dropped off, or at work they become more isolated, they're not partaking in a lot of activities at work, or their work in general has dropped off. These are, to me, the more key signs that the mental illness is taking a stronger hold. Because they've gone inside, they've become afraid to be who they were, and they don't feel comfortable in that. And so those are kind of an elevated level. The more basic ones are changes in mood and irritability, maybe changes in sleeping or eating habits. Those would be considered a little more minor, revving up type behaviors for me. And so where we have to be careful is some of those are common to adolescents, and so we don't want to put that, they're depressed and we're going to get them help or whatnot. But ultimately, there is that levels.
Okay, talking about Mental Health Month today, we want to put up a graphic in case people do want more information about all these things that we've been discussing today. We've got Catholic Charities, ccomaha.org, the Kim Foundation.org, another one here, NAMI Nebraska.org, and the National Suicide Prevention Hotline. Kevin, Janae, I want to thank you so much for being here today to share your time and expertise. Bottom line, if people suspect they need help, reach out and get it, okay?
Correct.
Thank you so much.
Thank you.
You bet. And thank you all for watching. As we close, a look at the Gerald Ford birthplace in Omaha as seen through the lens of Autumn Wimbush, a sophomore here at UNO. We'll see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at netnebraska.org/Consider This. If you'd like to share your comments about this program, call UNO Television at 402-554-2516 during regular business hours, or send an email to cwyatt@unomaha.edu.
Support for Consider This is provided by the University of Nebraska at Omaha College of Communication, Fine Arts, and Media. For more than 20 years, only one program has addressed topics that matter to viewers.
Only one program delivers the information that Nebraskans need to live the good life. I'm Kathy Wyatt. Join my guests and me as we discuss those issues every week on a program we call Consider This.